Welcome to the All Recovery Talk podcast, where we talk all things recovery and substance use related. We're your hosts. I'm Kevin.
And I'm Jennifer. This podcast was created for people in recovery, people with substance use disorders, allies of recovery, and everything in between.
Both Jennifer and I are in long term recovery and work at the only nationally recognized recovery community organization in North Dakota. Good afternoon, everyone. Welcome to another episode of All Recovery Talk with Kevin and Jennifer. On today's episode, we're going to get back to our topics from episode 3 and 4 about treatment. And our topic today is going to be called What Now? That being said, what now would involve what happens after you're done with treatment. Where do you go from there? Yeah. How are you today, Jennifer?
I'm fine.
Oh, you're fine? Super. It's a glorious, beautiful day outside. 72 degrees, I think it was, when I just got back from lunch. So what now? So we've gone through treatment. We've successfully completed treatment. Now what do? We just go back to what we were doing? Or do we figure out what to do next?
I mean, most people go back to what they were doing.
Okay, so for those people that would normally do that, what should we do? What should they work on? Excuse me.
Well, hopefully, when you were in treatment, you created a recovery plan for discharge and you follow that.
I mean, some places I believe do. I'm not sure about all places have a recovery plan.
Well, hopefully, you have some sort of a plan before you discharge, because you have to have a place to live. You have to have money. You have to have a job. You have to have a therapist, a psychiatrist, a primary care doctor, a dentist.
Do you though?
Yeah, you should.
I mean, that's what normal people have.
Yeah.
But I mean, these are people that are just coming out of treatment after God knows how long they've been using. I don't think that's, therapists and dentists and primary care physicians are right up there on their to-do list. So,
I don't know, when I got out of treatment, I had to have all of those appointments set up before I could be discharged.
oh, you went to a fancy treatment. I suppose they didn't want to see you come back, so they're ahead of the game in most places. Well, for me, when I got done with treatment, yeah, I had a relapse prevention plan, but I didn't have a recovery plan. What will I do if I'm triggered? Who can I talk to? Things like that. It wasn't in essence a recovery plan like, hey, within the first so many days I'm going to look at getting a job, or for me, I had a place that I was already going to go to when I was discharged. So I didn't have to look for housing. I didn't have to look for sober living because I didn't qualify for sober living due to my medications, things like that. So, my discharge plan was different than a recovery plan. So for me, I guess what now, for me would entail, what do I do when I get done with treatment to not relapse? For me it was that, I looked at, what is going to prevent me from staying clean? What is going to assist me in staying clean? There are many options to what now when you get done with treatment, especially, in Minot nowadays. There are sober living facilities for one to attend. There wasn't any for men when I got clean. Only in Bismarck, and like I said, I didn't qualify due to the medications that I was on. Um, but now, there's options for individuals that get, finished with treatment. They can apply while they're in treatment for sober living, whether they're male or female. There are multiple different treatment facilities as well that have, or there's two treatment facilities that are not state ran that have transitional living once they're done with treatment. There are two men's sober livings and 3 women's sober livings here in Minot that you can attend once you are done with treatment. I think that is an amazing thing. We went from having just one, women's sober living to now we have 3 women and 2 men's. I think wholeheartedly that sober living is a great option when you get out of treatment for that continuum of care when you come out of treatment. If it is a possibility, some people they have to go back to work. Some people have kids, that they have to go back to. But for those that that is a possibility, I think it is a great advantage to continuing that recovery process. What do you think?
Yeah.
You're
Yeah.
very, very, very talkative today, ma'am.
I mean, I had to go to sober living. It wasn't an option. So it was a required part of treatment for me. But I also, not everybody can do that, and one way or another you have to have a place to live.
Yeah, I get that.
So,
But I mean, that's not always a thing for some people. Some people go to treatment homeless. They finish treatment. It's not like they just all of a sudden have a home because they were in treatment.
right.
So, for some people, that's where getting into sober living really helps them. Because now they have a place to stay. They can continue on their recovery journey. And then while they're in there, they can get a job, look for a place to stay, get some recovery under their belt to where somebody will actually want to rent to them. Whereas before, they were just like not happening.
So we're talking sober living, not what now. We're talking about going to sober living.
No, well, that's part of what now, is sober living. Other parts of what now would be continuing services, whether that is at the treatment facility that you are at or gaining new services like Jennifer was talking about, a therapist, a primary care physician, a dentist, a psychiatrist, continuing community services and engaging in those community services that will assist you in your recovery.
Mm-hmm.
Those are a multitude of ones. There are also meetings that one can go to continue finding out different ways, and people to hang out with that are in recovery that can, help you along the way.
Mm-hmm.
Mm-hmm. So, what are your thoughts on having community supports that are able to assist you in finding the resources that one needs when trying to get into recovery if they've never been in recovery?
Well, I guess you have to get connected with somebody or something because you can't do it alone. We just can't do it alone. You have to first and foremost, you have to have a place to live. You have to have somewhere to go. And you have to have the supports, because how are you supposed to do any of these other things that you're talking about without support? You can't. I mean, how many people come out of treatment with a car and the money to put gas in that car, and the ability to, you know, get to meetings, get to these other things?
Uh, some.
Some,
Wouldn't say most, but some.
right? So are we talking what's next for the people that have these things, or that don't?
I guess per se we'll say for the time being, what's next for those that don't have these things? Because more often than not, we work with the individuals that don't have those things.
Well, if you don't have those things, then sober living is the option. It's kind of the only one if you don't have a place to live. Unless you're lucky enough to, at treatment, get connected with somebody who can help you get a place to live. Because I don't know about you, but when I came out of treatment, well, the first time I came out of sober living, while I was in sober living, I found a place to live. I had the time, I had the resources to be able to find that place to live. But if you don't have somewhere to live, where are you going? Probably back to the same friends to stay on their couch.
Yeah, people, places, and things. Yeah.
Yeah. So that first and foremost is incredibly important. I don't know what I would have done if I didn't, have the opportunity to go and find, have a safe place to be before I could find that place to live. And then there's, getting a driver's license, taking care of these necessities that so many of us didn't have before. I mean, how can you focus on your recovery if you don't have the basics covered?
I mean, well, I guess for me, I mean, it was like when I was about to exit treatment, and I got denied for sober living because of my medication. Um, I was gonna stay in my car. I was literally gonna live in my car.
But you had a car.
Yeah, but that was the length that I was gonna go to because I didn't want to come back to Minot. Like I wanted to stay in Bismarck because I didn't really know anybody in Bismarck. I couldn't just call somebody up in Bismarck and go pick up drugs like I could here. So I was to the point where I wanted something different so badly that I was going to stay in my car, and it was about to be winter out until I could figure out something, because that's what what I came to the conclusion that I needed to not use was to live in my car, because then it would allow me to not come back to Minot.
So, did you have someone or some sort of services that helped you figure out what to do?
I had counselors that were like, that sounds like a terrible idea. They talked me through my irrational fear that I had going on that got me to that decision, about moving back here. It was that's what it was. It was the decision was all rooted in fear. That I would come back to Minot, and next thing you know, I would see somebody at the gas station, and next thing you know, I'm doing hot rails in their basement. Just like that. So they talked me through, the pros and the cons of it, and I'm grateful for that, because they got me to see that, that I was at least being hesitant and cautious towards my actions that I was willing to take. That I was willing to put myself into a situation where I'm freezing my balls off in my car, sleeping at night, just so that I wasn't around people that were using. But yet, I would be parking in situations where there's probably people around me using.
Right.
Um, you know, so it turned into, me recognizing that at least I'm being cautious towards my actions and my decisions. That ultimately led me to moving back to Minot and living in my parents' basement.
Right. So, what can someone do? Say they're in a similar situation, but they're in treatment anywhere, right? They're
Mm-hmm.
what if sober living isn't an option? What can they do? What supportive services are there? What's the first step?
I guess so for supportive services around here, there's, if the individual's on probation, they can get signed up for Free Through Recovery. Now they can also, if they're on Medicaid expansion, they can get signed up for 1915I, which allows them to get supportive services from peer support specialists and care coordinators. There's also Community Connect. There's currently a wait list, but that is another program for individuals that aren't on probation. That you have somebody that's been through the situations that you're currently facing that knows how to navigate them.
So getting set up with peer support.
Yeah. Yeah. It all boils back down to like peer support and stuff like that.
It does, because peer support is someone who's been through it before.
Mm-hmm.
That's where I went to treatment. It wasn't called peer support, but my counselor was in recovery. She had 3 years clean while I was in treatment, and she had been through it. She told me exactly what services she went to get help, and
Mm-hmm.
helped me find a job that paid enough to get an apartment, and all of that. She might not have been called peer support. In some places, it's peer recovery support and recovery coach. Whatever it
Yep.
may be. It that really is, it's the key.
Yeah.
And sometimes, in my experience anyway, sometimes those are people from meetings. It might not be an official, like you were talking about, Free Through Recovery or whatever, because not every place has that, and it might not be an option for people.
Mm-hmm.
But getting connected with somebody who's been there and done that,
Yeah.
because how, I guess, for us, right? We who were both living with our parents, um, and we found a place to live, right?
Mm-hmm.
And how did you know to go to the place that we did? How did you know that they would accept you with your criminal record?
I didn't know. I called and laid out my criminal history, to the individual that does the applications, and she said, "All you can, you can apply, and we'll do a case by case basis, see where you're at, and then you'll either get denied or approved."
Really?
Yeah.
Feel like you may have lied to me 4 years ago then.
No, I might have.
Kind of rude.
Well, we are where we are. Happens.
But a lot of times, there's people, there's talk, right? People know. People have been through it.
Yep.
They know where to go, what services to access. There's so many different options and opportunities, and every state has them, right? Everyone knows, or not everyone, but a lot of people in recovery know, like, oh, you have criminal charges? Well, these are the 10 places that accept them, and these are the 5 that, like, don't even pay your application fee there.
Mm-hmm.
Right? Like, it's just kind of community knowledge,
Yeah.
right? And peer supports, recovery coaches, community navigators, whatever they're called, whatever that person might be called, they can help you navigate that. And they can help you navigate where to get a job.
Yeah, felon friendly, or people that hire people with criminal backgrounds.
Or
I mean,
places that
there's
are good at, if you have aftercare or whatever at
yeah that are
treatment.
yes, yeah, like McDonald's. McDonald's is a great place if you're in recovery, that allows you to um say if you're working for them and you need to go to treatment, they will more often than not, if you're a good employee, they'll hold your position until you get back. Um, or they'll work with you if you're getting out of treatment and you have aftercare. They'll work with around your schedule. Schedule you around those types of things.
Schedule
There's
around meetings.
yeah, there's lots of places nowadays that are willing to work with you as long as you're willing to work while you're there. Because they see the benefits. Um, that it actually saves them money to allow you to do these types of things versus you showing up and you being high and costing them money because you're messing things up. Getting orders wrong all night because you're messed up versus how much would it cost them to send you to a meeting for an hour.
Right.
The pros outweigh the cons in that in that aspect.
Right. And that's where that community-based support comes in.
hmm
Is, you know,
the knowledge that the peer supports have to navigate through all of these new and scary um, avenues that one will have to take while they're getting into recovery.
right.
That's like, say, on the topic of, oh, are you homeless when you get out of when you're getting out of treatment? Well, North Dakota has the ND Rent Help program for those that are homeless that will assist you with, if you are qualified, that for the first 3 months they'll pay all of your rent. They'll pay the deposit. They'll pay application fees, which sometimes works out. Um, and then it's a prorated, in essence, a prorated percentage of your rent for possibly up to a year.
Right. And you have to know how to access those things.
Yep.
I can tell you I didn't know about any of those types of things when I got out of treatment.
Yeah.
And I didn't know where to go, right? Like I got back to Minot after my second time in treatment, and all I knew was how to look up where meetings were, right?
Mm-hmm.
Like I didn't even know how to find aftercare or anything, which I wanted and was supposed to do. Didn't end up working out. But I didn't even know how to go about it. I had, like I mentioned, I had a dentist appointment, a therapist appointment, a psychiatrist appointment, primary care, OBGYN. I had all of these things set up. I had written down the meetings that I was going to go to. I had all of that, but I didn't know how to access some of those basic things.
Yeah.
That I mean, sure, the internet is a thing, but how overwhelming is it? If you're Googling trying to find something, and anytime you're looking for stuff, there's ads and there's misinformation, and it's, oh, do I actually qualify for this or not?
Yeah.
And all of that.
Yeah, that's where having somebody that knows all these things will come into play. Like peer support. Um, another good avenue, that has come out lately, if you've completed treatment, is the ADRL grant that will assist with a deposit, and it will allow you to be able to get furniture up to $1,500. That's if you've completed treatment.
Inpatient treatment.
Yeah.
For a long enough period of time.
30 days.
Yeah, and treatment is 28 days, so
It's 28, 30 days. It's 28-day program.
They're getting very strict.
Mm. Well, as far as I know, that it was, they utilized that a lot when I worked at North Central. Was people would get on that program once they completed the 28-day program.
There's a lot of options. A lot of There's a lot of support, but across the country, across our state, across, you know, even other countries, it's really that peer recovery support network that helps. It's literally the job of a peer support to help you navigate the system.
Yeah. One of their jobs, one of the many jobs that peer support specialists do.
Right. But I guess for me, in my opinion, what now after treatment or when you're getting ready to leave treatment is getting connected to somebody who can help you with all of it. And sometimes that might be sober living. Sober living, a lot of them probably have someone who can help you with that, or have the information for a place that can help you with that.
Yeah. Yep.
And treatment centers more than likely have at least some basic information on where to start. Because really, we can't just leave treatment and assume that because we were gone for 28 days that everything is magically fixed.
Yeah, no.
We have to have some sort of a plan. And if you're not making that in treatment, I would highly suggest making it as soon as you're out.
Yeah.
Because if you don't know what you're doing next, how do you do anything?
Yeah, how do you figure anything out when you don't have prior knowledge?
Right.
It's just like, that was, for me, I used for over half my life. I didn't know how to live a normal day-to-day life, let alone how to make decisions or even how to even come up with a plan to make a decision, because I knew how to use drugs, how to get drugs, how to, get rid of drugs. I didn't know how to really get a job, that wasn't, like a fast food restaurant or, I had maybe 3 jobs while I was in active addiction, and most of them were like, hey, here's a job. I think I applied for like 1 job, and that was when I worked at the Chrysler Center here at Change in Oil. And the only reason that I applied for it was because my girlfriend at the time's mom worked there, and she's like, hey, you need a job, apply, they're hiring. So that's what I did. But other than that, I didn't know how to apply for jobs. I didn't know how to make a resume. I didn't know how to do normal basic things. Like I didn't know how to call to make a doctor's appointment,
or how to get insurance.
Yeah. I didn't know how to do any of that. My mom used to make doctor's appointments for me, because she knew what to do. I didn't,
Yeah, your wife does.
Yeah. Nope. I know how to make them now though, but I refuse to go, so my wife has to make my doctor's appointments for me and dentist appointments because then it's a scheduled date and then I have to go.
Mm-hmm.
But, for the most part, when I was in early recovery, I had to ask for help, from people. For me, it was people in meetings. That's where I got my information from, was people in meetings, that have already done all of these things, that had the knowledge that I did not have. And I like to talk to people that, had the knowledge versus talking to people that just thought they knew. Because I got told early that, misinformed people give misinformed information, and I wasn't trying to end up with a whole lot of misinformed information to where, I would try something and then I get discouraged because I listened to somebody that, necessarily didn't have the correct information. So that when I called to do something, the people I talked to were just like, I have no idea what you're talking about. And that's the last time I do something like that.
Mhm.
But so I asked many people, and when I would get like a consensus of all these answers, and I would look at the ones that were pretty much, the same answers and be like, that must be the answer, like a multiple choice. Well, everybody answered D, must be the answer,
Mhm.
like when you'd phone a friend or poll the audience, so that, I could do it, but I had prior knowledge, that I had learned from others. Because I wasn't, when I was in early recovery, I wasn't going to try and do things by myself. Because I was fragile. I'm not gonna lie, I was fragile when I first got into recovery. To where if something didn't work out because I tried it on my own, well, I would never try to do it again.
Mhm.
And for me trying to get clean and actually clean for the first time, you know, I didn't want to jeopardize what I, barely even had at that time, which was just a little bit of some clean time.
Mhm.
Mm-hmm. Anything else you got?
No, I mean, I think we kind of reached that conclusion is reach out to somebody who's been there.
Mm-hmm.
That's what you do next.
Yep. Well, I guess for this week's call of action, reach out to somebody, that has prior knowledge, and ask for help, because we aren't alone. There's somebody that has been through what you're currently going through. And so all it is just reaching out and asking somebody if they have the knowledge and they can assist you.
Yeah.
All right. Well, that's it for this week. We shall see you next week. Um, Next week we might, we might end up starting we do a little mini series that is all things that recovery is involved, like parenting in recovery, relationships in recovery, fun in recovery, um, a recovery plan, things that recovery involves once you get into recovery. Might even talk about medication, therapy. You never know. Just show up, find out. We'll see you all next week. Have a good weekend.